historically, MPN-AP BP has been associated with limited overall survival outcomes, typically a year or less. Since 2017, there have been several new therapies that have been FDA approved for acute myeloid leukemia. And oftentimes, our management of accelerated and blast phase MPNs utilizes those drugs. So we kind of repurpose these AML drugs and we'll use them for accelerated and blast phase disease. So with that in mind, myself and several investigators put together a cohort of approximately 200 patients with MPN-AP BP that were diagnosed in 2017 or later, so kind of in the present day or current era of AML therapies. And the results that we found were quite sobering. So the median overall survival is still less than a year. It's about 0.9 years. Interestingly, we also found that the frontline treatment regimen does not have a significant impact on overall survival. So the three most common regimens were intensive chemotherapy, HMA plus venetoclax, or HMA-based therapies that did not have venetoclax. And median overall survival was not statistically different and was actually numerically longer in the HMA-based therapy arm. We also looked at patients that ultimately made it to allo transplant, and the median overall survival in those patients, so about 65 of our patients made it to a transplant. The median overall survival was about 2.3 years from time of transplant. Really, I think underscoring that fact that the goal for eligible patients with MPN-AP BP should be to obtain disease control, undergo a transplant workup, and then proceed with transplant if they're a good candidate for a transplant. That really seems to be the main strategy that offers durable survival in this disease.